Okay, people are going to start trickling in now.
Okay. They're rushing in. They're not trickling. Oh my gosh. Good morning.
Good morning.
Understood if you said. You don't need to hear from anyone.
Good morning, everyone. We're just letting people in now. We've got a full house today, so that's going to take a minute or two, and then we'll get started. But thanks, 110 people attending this today, so we're excited that you're all here. It's just going to take us a couple minutes to make sure that everybody gets in, and then we'll get started. Jacob, let us know when you think everybody's in, or most everybody's in. Some people will trickle.
Yeah, it should just be another minute or two.
Okay. All right, how are we feeling?
Yeah, we're about halfway there, but I think we can get started, and people can always watch the video if they missed the first bit.
Okay, well, I don't mean to rush you.
No, it's all good.
Okay. Wow, good afternoon, everybody. How is everyone? My name is Joy Church, and I'm from Venture Portland, as is Jacob over here. Am I pointing in the right direction for everyone? We're happy to be co-hosting this listening session today on personal services. So thanks for allowing us to do this. Thank you, Prosper Portland. So a couple of notes right away, everybody. So we are recording this session. And so something we ask you to do is in your little box, go to your name and please click on your name and a little drop down will come down that says rename. If you'll put your name and your business, that would be really helpful too. So people, everybody could do that now, that would be great. Okay. All right, so we've got a full house today, 110 people signed up to be with us, so we're really excited that you're here. First of all, again, welcome. So it's been a tumultuous year so far, and I want to acknowledge that we absolutely stand with our Black community, and our heart and passion and empathy go out to our African American friends and family during this very difficult time. I want to thank you all for being here today as we look towards reopening. So we've got a lot going on in our world, and so thank you for making the time to be with us for this 90-minute session. And again, we are recording, so if you need to leave or you need to come in and out, that's fine. This will go up on our YouTube channel, so you can watch it anytime. So if you have things that take you away, we totally understand that. So one of the things that we want to talk about here a little bit is not only are we recording, but there is the potential issue of Zoom bombing. And so if that happens, if we have a disruptor on the call, we will immediately end the call without notice likely, but go to your email and wait for a fresh link. It should take less than 5 minutes for us to get you a new link. And then we'll go right back into this meeting, just so everybody knows that. And today is a listening session, so we don't have all the answers. We are here to all listen and learn from one another and gather information so that we can take that back to wherever we go to try to get ready for reopening and to answer those questions. So again, it does not mean that we all have all the answers yet, but we are, as I said in the last one that we did, we are truly flying the plane while we're building the plane. So we're all in this together. So thanks for being here. So I'd like to start with Tori Campbell. Tori Campbell is with Prosper Portland. He's the Director of Economic Development. Tori, good afternoon.
Good afternoon. Thank you, Joy. Just wanted to start by, again, welcoming you to this opportunity to really provide space for businesses that almost unlike any other industry, proximity and closeness to your client is an essential in order for you to deliver your services in a thoughtful and a meaningful way. And so we realized in light of COVID-19, this is an important conversation for this sector of personal services. And so we've been having these listening sessions over the last 2 weeks with a number of industries, also focusing on culturally specific communities and businesses within to make sure that any and all of the initiatives that we are working on in support of the small business community, which is the backbone of our economy in our city, that we get it right, or that in our iteration that we continue to improve on. And so much of what you're going to share, what we're going to hear will help to inform that process as we move forward. You'll also see on the screen just a good example of what the city, our economic strategy has been as we have moved through these various phases defined as relief or stabilization. And as we move into reopening, we are anticipating over the next months to years, recovery will be top priority. But I know for many of you businesses, this has not come in phases. It's really been a rolling nightmare. And so we recognize that, and we want to move with a level of empathy and nimbleness, which oftentimes government is not always described as being nimble, but we realize we need to be responsive in meeting the needs and pressures that you're feeling every day, particularly as we prepare towards reopening. So glad to be on the call. We really appreciate the time. Happy that we are able to have this conversation, knowing that it's going to really play an instrumental role in informing how we go about moving forward in the hours and days ahead. So thank you.
Thanks, Tori. So guests that are just joining us, I want to mention again that we are recording. We would love it if you could go to your name and click on that and rename yourself with your name and your business because this is about personal services and we want to make sure to know who is here with us today. And as well, you can use the hand raise function when we get into the Q&A, and you can also put questions into the chat, and we'll do our best to monitor those questions and get to them during the Q&A piece. Okay, again, welcome and thanks for being here. Rahana, how are you today?
Good morning, Joy. Hopefully you can hear me.
Yes, we can hear you. Thank you for being with us. Rehana is with the Office of Governor Brown. She's the Regional Solutions Coordinator. So thank you for being with us today.
Thank you. Good afternoon, everyone. I'm Rehana Ansari, as Joy just mentioned.
Actually, Rehana, can you turn up your volume by any chance?
Okay, is that better?
Yeah, keep talking.
Okay, I apologize. Let me know if it goes in and out. So again, good afternoon, everyone. I'm Rehana Ansari, the Governor's Regional Solutions Lead for the Metro region. Thank you to Venture Portland and Prosper Portland for hosting this listening session and for the opportunity to share a brief high-level overview of the Governor's reopening plan. Most importantly, though, I look forward to hearing from you all about your thoughts and concerns and what it is that you're experiencing on the ground. The Governor's framework for reopening Oregon is designed to be cautious, incremental, and gradual based on science and data. In Oregon, we've flattened the curve, but we know it's not without the sacrifices that you and others have made. The Governor's top priority is ensuring the public health and safety of everyone. At the same time, we know that people are experiencing significant economic hardship. The Governor's reopening plan strives to achieve the delicate balance between public health and the health of our economy. It consists of 3 phases and requires that prerequisites be met before a county or health region may advance into a phase. Later, you'll hear from our partners at Multnomah County about their status and plans for entering into phase 1 of the reopening. Governor's goals for reopening include the list of things here, such as minimize hospitalizations and deaths, allow people to safely return to work so that they can support themselves and their families, minimize risk to frontline workers, protect those at highest risk of severe illness, especially communities of color, and support for small local gatherings that preserve community cohesion and cultural practices. Next slide, please. Please understand that it's important that even as we reopen, life will look different. We'll be living with the virus until there's a reliable treatment or vaccine, which is still many, many months out. Until then, the primary tools that we have to fight the virus are actually pretty low tech and involve physical distancing and personal hygiene. Every restriction that we lift will increase transmission and the number of cases. That's why it's important for us to reopen in a thoughtful and safe manner. Next slide, please. This graphic shows the types of activities and businesses that are allowed in each phase and the guidelines that are associated with each activity or business in each phase. The left side represents guidelines that apply statewide in the baseline phase, so in advance of entering into any phase 1, phase 2, or phase 3. The guidelines exist statewide for outdoor recreation, retail stores, childcare, summer school camps, youth activities, and restaurants, takeout only. The middle applies to counties in phase 1. These are the activities that are allowed under guidelines in phase 1. Restaurants and bars, personal service providers such as nail, hair salons, massage, tattoo parlors, etc., malls, gyms, and local gatherings of no more than 25 people, so long as you're able to maintain physical distancing. The right side applies to counties in phase 2. After at least 21 days in phase 1, counties that continue to meet the prerequisites may be able to enter phase 2. Things that are included in phase 2 include expanded gathering size of up to 250 people for indoor and outdoor entertainment facilities and at venues and events. Some office work, telework is still strongly recommended, and some changes to the restaurant and bar industry, extending the curfew to midnight as opposed to 10 p.m. Phase 3 won't happen until there's a reliable treatment or vaccine, which again is many, many months out. But concerts, live audience, sports, conventions, festivals won't happen until there's a reliable treatment or vaccine. Next slide, please. Next slide, please. Oh, thank you. Given time constraints, I won't go over all of the sector-specific guidelines in detail. Instead, here are some examples of the types of guidelines that exist for the personal services industry. Things like appointments and pre-appointment health check required, including maintaining a customer log, 6 feet of physical distance, removing all magazines and newspapers, snacks and beverages from waiting areas, face coverings, capes, smocks required by employees and for clients depending on the services provided. Common themes throughout these sector guidelines and all other sector guidelines include physical distancing, increased cleaning and sanitization, face coverings, and keeping an eye out for symptoms. Next slide, please. Finally, you may find information and resources about the reopening and industry sector guidelines on the Governor and Oregon Health Authority's web pages. And with that, I'll turn it over to our partners at Multnomah County. I'm happy to answer any questions afterward. Thank you.
Thanks, Rihanna. So Jessica Guernsey is with us from Multnomah County. She's the Deputy Director of Public Health. Jessica, thanks for being with us today.
Sure, thanks for having me. Can you all hear me okay?
Yes, thank you.
Perfect. Well, yeah, thank you again for hosting this event, and thanks to all of the business owners on the phone. I cannot thank you enough for your collective actions and participating in what may be one of the largest organized efforts around community health of our lifetime. And so I really appreciate the sacrifices that you all have made to help protect people's health. I'm going to go through the reopening dashboard for Multnomah County. It's a little bit different than some of the rest of the state. We'll talk a little bit about what our numbers look like, contact tracing, what we call isolation facilities, our testing capacity, a little bit about healthcare, and personal protective equipment. So I think folks know, obviously, we submitted our application for phase 1 last week. Right now, we have a target date of reopening of this Friday, June 12th. So we are waiting to have the state review our application, and we should know some updated numbers no later than Thursday. We'll walk through what those specific numbers are. Next slide, please. So I kind of just reviewed this. We applied on June 5th. We expect a full review by June 10th, and if all proceeds as planned, we will move into phase 1 on June 12th. Next slide, please. We've talked a little bit about this, but really, you know, as a couple folks said, we are left with really basic prevention efforts right now to prevent the spread of COVID-19 and other illnesses. All the things that people are doing right now are basic prevention measures that also prevent flu and other communicable diseases. So the things that you all are doing now regarding, or will be doing, as some retail environments and other folks are doing now, are really practical things that can be done to prevent many communicable diseases. So starting with limiting the number of people that are in a store in an environment where we can keep at least 6 feet of distance between people. Obviously asking folks, whether they're employees or customers who are symptomatic or sick, to stay home. Frequently cleaning and sanitizing high-touch surfaces is an important component. And then requiring employees to wear face coverings and asking customers to wear them as well, with the acknowledgement that there are some situations in which a face covering cannot be worn. Next slide. Oh, was that it? Sorry.
Yeah, there were only 3 slides.
So do you want me to talk a little bit about our reopening criteria?
I think that would be very relevant.
Okay. So I'm sorry, I misread the first slide. If you could go back to that first slide, I didn't realize that was the only slide that referred to the reopening criteria. Is that possible? Perfect. So I'm not going to go over every single criteria that we have. Most of them are universal for the state. Clearly, we're going to be looking at, and the state will be looking at, the spread of COVID-19. What does our positivity rate look like in the community, including our hospitalization rate. So there are specific thresholds that have been set by the state. We did add a different criteria for Multnomah County only, that we also are looking specifically at hospitalization for Black, Indigenous, and people of color communities in Multnomah County. We added that specific criteria for our considerations for reopening, because we know that COVID-19 has disproportionately affected BIPOC communities. So we wanted to call that out, to have that considered in whether or not we would move into phase 1. So that is different than the state criteria. Contact tracing, I'm sure folks have heard a ton about. We're well on our way to meeting that metric. I think we're close to 60% of hiring for the staff that we need to provide contact tracing, which is the folks that call folks and figure out what kind of exposure someone may have experienced and assess what the risk is for other people. We're spending a lot of time ensuring that we're either hiring or contracting with community-based agencies that serve the linguistic and cultural needs of Multnomah County. So we are taking our time in doing that to make sure that we are adequately equipped to reach the communities that are most affected by COVID-19. We had to demonstrate that we had the ability to safely isolate folks that might be experiencing COVID-19. I'm not a huge fan of the term isolation facilities. It sounds very scary. It does mean, though, that we have the ability to utilize hotels and other facilities to provide safe recovery space for someone who is sick, who can't maybe isolate at home. So that was one of the criteria. And then testing capacity, we meet this criteria. There is quite a bit of testing capacity in the healthcare delivery system. However, we are building out additional testing to reach communities that are most impacted by COVID-19. So we're not just relying on healthcare testing, we are also building out additional community testing for folks that might have a hard time accessing healthcare-based community, or excuse me, healthcare community testing. The healthcare capacity metric is really one that the state looks at and tells us that we meet that capacity. We need to demonstrate that we have 20% surge capacity for our hospitals regionally in order to meet the reopening criteria. And then the final metric is personal protective equipment. We need to demonstrate that we have enough personal protective equipment in certain arenas, like for emergency medical responders. But this is another area where we've added an additional criteria for Multnomah County specifically. We wanted to ensure that we were able to provide personal protective equipment to key community partners that serve vulnerable populations, community-based agencies, healthcare, different healthcare, public health partners. So this is another metric that we added on locally because we know that it is going to be so important for our partners in the community to continue to operate, that we also wanted to make sure we could meet a metric where we could help provide that for important partners.
Thank you, Jessica.
Yeah.
Thank you. And Jamie Dunphy with Mayor Wheeler's office is with us today as well. I lost you here. There you are.
I'm over here. There we go.
Hi, Jamie. How are you?
Hey, I'm doing as well as can be expected, I suspect. Hey, good morning, everybody. I'm going to be very quick because I am less interested in hearing myself talk and more interested in hearing from many of you. I recognize a lot of the names and faces on here already. I've met a number of you in my previous title, which I was the Senior Policy Director for Commissioner Nick Fish up until his death earlier this year. And in the intervening months, I have been helping Mayor Wheeler's team with regard to the economic recovery. And my big interest here today is trying to hear directly from you folks about the challenges that you are specifically going to be facing as you move towards reopening. We know that there are some enormous challenges just hitting everybody. But we know that there are some specific challenges that are facing personal services and folks who are unable to really adhere to physical distancing standards as an inherent part of what their job is. And City Council, your Portland City Council is going to be making some decisions soon about how we can support the community and how we can invest some very limited dollars to try and get the maximum bang for our buck and trying to help the community in the broadest sense. So I'm here to listen. I want to hear specifically what are the things that City Council needs to know in the next couple weeks about what will make the difference and what the City of Portland can do to make that difference for your industries to continue to succeed. So I'm mostly going to listen. I'm going to shut up now, and I'm really thankful to be here with everybody this morning. Afternoon. It's afternoon.
Thanks, Jamie. So Jamal Lane is here with us today. Jamal, thank you so much for taking the time out. And Jamal owns 3 places, Champions Barber Institute and Champions Barber Shops, Multnomah County and Washington County. And so we're very excited to hear, Jamal, how things are going with your reopening, getting ready to reopen, and what your biggest challenges and priorities are.
All right, yeah, thanks for having me. Glad to be here. Glad to be able to represent, my industry from my perspective and what I'm dealing with and going through as we reopen and just through this whole process, what it's been like. Honestly, as you guys know, a lot of people are excited to get back to work, have been looking forward to having a reopening date that they can start to, build from. And I think that was one of the most important things is having a date, which now a lot of people have. And it's still potentially, right? Not quite sure if everything goes as it's planned to go. I think the biggest thing for me has been understanding what's going to be expected from all the, what you guys just laid out, what's expected of us, what we need to have PPE wise, the distances that we need to have within our spaces. Those things, and from the conversations I've had with other barbershop owners, salon owners, some of those things are very, very hard to do in our spaces because some people have limited space. So I'm gonna talk about that one first. People that have limited space, maybe their chairs are, 4.5 feet, 5 feet away from each other, and they have multiple chairs in the shop. Maybe they don't have the room to spread out that 6 feet. And so what does that, what does that look like? Are they still able to function if they have the other PPE, if they have, the mask on the client and on the practitioner? Can they still work? That's been a question that I've been hearing. Some people just don't have that space. Another big one, of course, is, with shops opening up and then you have people that aren't quite as comfortable with going back. And some people, while some are excited, some are feeling like they might be forced to go back to work or might lose their potential position because the shop opens up and they're not willing to come back yet. That's a concern. For me, one of my biggest concerns has been on the leasehold end. While I have one space that is in a building that's owned by the city, have another space that's that are privately owned. Some of the other places, a lot of the rents have been what has been called deferred. And when you've been in a position for 3 months and you haven't been able to make any income, and then are expected to come back and still pay that, even though it's deferred and it may be broken up over time, you're still kind of digging yourself out of a hole. And when you've been put in a situation that was of no, you didn't create it, right? It was mandated that you close up your business and not receive revenue. That's kind of tough to be expected to pay, especially from, my standpoint of being in a building that's owned by the city. It's like, we got shut down. You guys understand what's going on, and you still expect for us to pay for time that we haven't been able to function. That bothers me a lot with that expectation. Where I've actually had, and the reason why, one of the biggest reasons why it bothers me is I have spaces where landlords have said, I have 4 total, and some have said, you know what, we're going to waive, certain months. And for those private entities to be able to say that, and for the city not to be able to say that for, tenants of buildings that they own, is kind of puzzling to me. So that's something that I've been dealing with and hopefully can sit down and hash out going forward. But those are some of the things, and just going back to, again, the safety of the 6 feet. Something that I talked about previously was if you're in that situation and you can't quite distance 6 feet, which we're going to be within arm's reach of our client the whole time. What is the difference between I guess if you have mask on, what's the difference of being within arm's length of a client but being 6 feet from the next practitioner? Like that doesn't really make a whole lot of sense. So That's another, concern. Something that I thought would be very beneficial, because I've heard people talk about in some of the previous conversations we've had, PPE, as of course, is a big deal, and people accessing the right PPE. And when I say right, I mean in forms of quality. Some people still don't know exactly what to get. And the access, of course, we know is starting to get a little bit better. But with the organizations that we are, on this call with, having a situation where shop owners or practitioners, independent contractors can actually go to a centralized place and access the things that they need, I think would cut a lot of anxiety out as far as trying to, because some people are actually going to rush back. If they say, okay, you guys can go back to work on Friday, some people are going to jump back in and be ready to go back to work on Friday without having gone and gotten what they needed, right? They're going to just scrambling now this week trying to find what they need. And I don't think that's going to work out to be a safe situation. And so if people were able to actually go to a centralized place here in the city or different parts of the city and access that PPE, I think that would be a great help. Even if some of this PPE was donated, it may not be a lot, but at some amount be donated to some practitioners or shop owners, that would be great as well. Because again, we know people haven't been able to make money. Going out, trying to spend on these types of things is already going to be tight for people. So I think that would be very beneficial as well. When it comes down to it, people are ready to get back to work, but people are still, a large amount of people are still hesitant behind going back to work based on the safety part. And so you just have a 50-50 almost of people that understand it. They know what they need. Some already got it. They're ready to go back to work, right? And then others, even within this time, they still don't have it together, for whatever reasons, that may be. So helping those people even more, being real strategic about that, I think would be very, very helpful. I'm ready to get back at it. Like I said, I got a shop in Washington County. We waited some time. We was actually able to go back on the 1st. It's a 6-tier shop. I'm only starting 2 barbers at a time. We're going to stagger as we get into this. I'm not bringing everybody back at once. Again, trying to, be safe, right? And fill it out and see how things are actually going to be. And we don't want a whole bunch of people, again, in the shop at one time. Even though it's 1 per barber, that's still a nice amount of people at one time, because everybody's going to be full when they come back. And so staggering it is an option. I think if barbers are able to, or even just stylists or any type of industry that have shops, if they're able to do that, that would be helpful as well. So that's our plan. So yeah, we just go slowly. And even, if we're able to come back Friday, we're not going to jump right in, with everybody in the shop at once. We're going to still take our time and ease our way into this thing. You're muted, Joy.
Thank you.
There you go.
What? Thank you. Can you hear me now?
Yep.
Great. So Jamal, for Washington County, even though you could have opened on June 1st, you decided to wait.
Mm-hmm.
And so can you walk us through what led you to that decision to go ahead and wait?
Well, again, I don't want to feel rushed. It's automatic that people's expectancy to get back to work. Everybody's ready to go. But as owners, we have to be in control of that. You know what I mean? And kind of, we have to pace ourselves, in my opinion. And so I don't want people to jump in head first and you're moving too fast and maybe you don't do the things that need to be done. So we're taking our time. Mm-hmm. Granted, we've been off all this time, but still, we're going to ease our way into this, be level-headed as we're doing it, so we don't miss any steps along the way.
Understood. And that seems very wise to, take it at your pace, right?
Mm-hmm.
When you're feeling ready and secure. And so in terms of, you mentioned like the staff confidence about coming back. And how does that translate to your customer confidence? What are you hearing from them?
Well, the customers, it's surprising. The customers are very, well, not so much surprising, but they ready. They've been ready. I think they look at it as if, you're going grocery shopping, right? I mean, everybody's going grocery shopping. Everybody's going to McDonald's still. Everybody's going wherever they're going still. We're the kind of the last ones to be let back in the game. And so our clients have been ready. I think for, the precautions that are in place, they understand that that's what's going to keep us safest. There's still always a possibility, right? But the clients, they're ready. And we're doing other things to show them that we are going above and beyond, to be, ready in forms of safety and sanitation, and also the guidelines that have been set.
And
Because
Jamal,
we already had a heightened level of safety and sanitation anyway. So just going that extra mile to ensure them that we're doing that and some.
right, yeah, such is the nature of your business that safety and health are always on our top of mind.
Right.
And so you mentioned that you've been doing some things to showcase to your customers that you are taking extra precautions. And so what does that look like? Is that through Instagram, or how are you getting the word out?
Instagram's a great way. I know that a lot of barbers have been doing this. It's a Barberside certificate. It's kind of like a certification almost for safety and sanitation. And a lot of barbers have been posting that. I know all of my barbers, for the most part, have taken the test. It's like the online free test through Barberside. You just go in there and you can take that, and you can print out a certificate. And again, that's just a way to show we are mindful of what's going on. We even though we've already been licensed through our state and understand these same things already, in this time, we're going to do this as well. Having people, professional cleaners, which a lot of people already do, but being that we've been off, having correct professional cleaners come in prior to open, that's something as well. Going in and doing a complete detail of your shop, maybe even recording that if some of you guys, are into Instagram and Facebook and doing the different types of posts like that, record it, show them. I think that's great. And this is a great time to do that. If anybody hasn't done that yet as a shop owner over this last few months, haven't gone in detail, you better definitely go do that before you open up, because again, it's a great opportunity to do it.
Excellent. Thank you so much. And so I want to introduce our next guest. And Jamal, will keep circling back to you, of course, throughout this entire thing.
Right.
Guillem Ortega is the owner of Hand and Stone Spa. And Guillem, you've got 3, right? You've got Multnomah County and Washington County.
Yes.
And how are things going for you?
Well, obviously, we haven't been open. We haven't been able to open in Multnomah County because still closed. We opened our location in Hillsboro on Monday last week. And we opened because we were ready to go. I mean, it's not like we rushed in this case. So we, almost 3 months of confinement gave us time to be prepared to work on new protocols, to order the PPE material that we need to provide to our staff. And we were ready to go. And again, echoing what Jamal said before, the clients were ready, right? I mean, obviously, we hear of the clients that are ready. I mean, of course, there are clients that are not ready. So the ones that are ready, they come and they tell us, and they are serviced, right? So I think in that respect, I think that obviously, clients and even therapists, they are basically like 2 schools of thoughts, right? So those that they're ready to go, they want to start to get to the new normal, right? And the new normal for many people is to get back with precautions and safety manner to do the things that they think they needed and to go to their jobs. And there's some other that they, some of the clients, some of the staff that they they think it's not safe still to do that, to practice that, or to have that service, right? And that's all respectful, right? But yeah, I mean, that's how we need to, you know, to balance this up as from a business point of view, right? And I think that, from my humble opinion, I think that the authorities somehow could help a little bit on this, right? I think that we've been told for many weeks, for months, that we were heroes if we were staying at home, which I think is a great message. And I think that was the right thing to say to people at that point, when we were basically trying to beat the curve, to assess the situations, to be ready in case that things really went bad. And I think that right now we are in a different stage. I think that we are in a much more controlled stage. And I think that maybe the message should start to see, okay, you know, I mean, maybe it's time to, with caution, to start to get back to the new normal, right? Because that's, I mean, kind of stay at home forever waiting for a vaccine. I mean, we don't know if we'll have a vaccine. We don't know when it's going to happen, right? So we need to start to move on in this new normal. And I think it will be good to have a more institutional message that invite people to try to test the waters out there.
I see. Yeah, that's an interesting idea, right? To help with consumer confidence, to
Yeah.
get people feeling like they can begin to move out with precautions.
Yeah, I mean, because that's the whole thing. I mean, all the investment that we are doing on PPE, all the investment, all the precautions that we are doing to do it. I mean, it's not just something like we do because the state is or the county is saying that we have to do. It is because the right thing to do, but it's good to communicate to the clients, to the consumers, even to our staff that, hey, we're doing that to try to get on, move on, right?
And for them, in terms of training staff with these new precautions, what does that look like? Can you walk us through it a little bit? Like,
Well,
what are the major changes?
No, it's good. I mean, what we did is like the week before we open, again, in the case of Washington, we knew 1 week earlier that we were going to open. Case of Multnomah, we are now operating as if we are going to open on Friday, right? So we are right now doing, we do trainings with the staff. We invite our massage therapists and estheticians to come to the spa. We have designated one of our senior members of the organization to train with the new protocols. We showed all the PPE that we have purchased for them, the mask, face shields for the estheticians. You know, we have to invite the team to get familiar. We just not like invite them to come right away and start to see clients. They need to be confident, right? We have actually reduced the number of services that they provide per day during the first 2 weeks. So they, you know, at the end of the day, in the case of massage therapists, if they've been for 3 months not doing anything, the body needs to get back to that you know, motion, right? So we've been also, we haven't rushed. I mean, we open when we can open, and we are trying to make sure that our staff is comfortably coming back.
And so can you also walk us through, so for the massage part of your business, which is a big piece, so what does it look like in terms of the client's point of view? What kinds of things do they need to think about in preparation to come and see you?
Well, basically, we're following the guidelines from the state and the county, right? So basically, the clients, so we basically every communication is done through digitally. So basically, the intake form, they sign a waiver before they come in. Is all. We use EverSign, which is one of the many tools that you can use. There's DocuSign, everything. So they need to stay at the car before they come in. So we text them when we are ready to allow them to come into the spa. We ask, obviously they need to wear a mask when they are in the premises of the spa. We ask them to wear the mask when they are facing up, and we suggest them to wear the mask also where they are facing down. I mean, it's like almost like you are in a plane, like they're telling you, fasten your seatbelt when you were taking off and landing. I mean, and we recommend you to keep so same thing with the mask. If the client can do it, they will do that, right? So I think that the one thing I would say is that our experience in the last 8 days that we have open Hillsborough, as clients are very, very, very accommodating, very accommodating. I think that we have zero incident with any client because we ask them to wear a mask or because zero. I mean, I think that's maybe because part of living in Oregon, you know, or mentality, or I don't know, but it's really, really, really rewarding for everybody in the spot having that type of clientele. I mean, which I think is going to be the clientele that I have, the clientele that Jamal have, or any of the listeners probably will have it. It's not like my specific clients.
Yeah, I'm glad to hear that. And Jamal, how has it been for you with clients so far about abiding by wearing a mask and that sort of thing? Has there been any pushback, or how's it going?
Well, clients, they wear a mask anyway. And so, I mean, it's going to be something that, like I said, today is our first day, you know, in our Washington County shop. And so it's understood that you have to have a mask to come in, you know, and I don't think that there's going to be any pushback. If they don't have one, then we have masks available for them to purchase. And then that's, if they want to get their service, then that's what they have to do.
Okay, so it's just that clear. It's a cut and dry.
Yeah, I mean, you know, and I think all of us have been out, you know, doing what we've been doing. And we've seen, I'm pretty sure everybody on here has seen stores that you cannot come in here without a mask. What do? We put a mask on, you know, if we want to go in that store. So same thing's going to go, it goes for us. Nothing's changing with that.
Okay, great. Glad to hear that.
Just one other point I'd like to mention. It's like I saw some of the comments in this area about the testing, which I don't know if it's something that you wanted to touch later, but for us, one of the things that, one of the areas that I think that for us as an owner, I guess for any independent contractor, anybody, right, that it's important, will be important to have clarities on the testing requirements. I think that the OHA, basically the OHA, the last set of guidelines that they communicated, they say that testing will be available for anybody who has been exposed, even if they don't have any symptom, right? So obviously for our industry, I mean, the big question is, so what happens if we get a call of a tracer saying, hey, one of your clients test positive, right? I mean, for us, sending that therapist 15 days home in quarantine, I don't think it's helping anybody, right? It's not helping the therapist, it's not helping also the community, because what if the symptoms comes up 14 days later, right? So then for 14 days, we haven't tell anybody that we have a positive in our staff, right? So I just think that it will be really, really helpful for us is like that there's the capacity of, and the first right away after having a notification that one of our clients has tested positive, that there is a easy and free testing capacity for the staff right away, not having to wait until the symptoms come up, right? I think that will help also to control in the any potential outbreak in the community, and it will help our business in a tremendous manner. I don't know, that's something that, because I've been contacting my health plan, and there's no clarity. I know that it's the OHA already made that clear, but it's just still, they are still, my health insurance, they still are asking for the approval of one of the doctor, and it seems like really, really long for non-symptomatic potential people who have been exposed to the COVID-19.
So Guillaume, I'm sorry, I think I missed a bit of what you said. It went out a little bit. Can you talk about that again with your health insurance?
I'm saying that we have a health plan in our company, right? So I contacted them and said, listen, I heard that the OHA is now allowing non-symptomatic people who have been exposed to COVID-19 to be tested? The answer that so far I'm getting is like, yes, but they need to go to their doctor, and the doctor needs to, recommend or ask for a test, right? Which, again, I feel like it shouldn't be that this. I mean, I should be like, okay, like, I've been exposed. I have a call from a tracer. I've been exposed. I need to be tested. Period. Right. Let's move on. I mean, like, I think that we can't just get into a maze of, hey, I need a doctor. I need to ask for an appointment with a doctor. I mean, and 2 weeks later, I have an approval from the doctor. I mean, it's too late. I mean, so I think that we need to figure out ways. I think it's in our industry and probably many other areas that the moment that a tracer calls you, there is access to testing right away for free.
Okay.
That makes sense.
Thank you for the clarity there. Jessica or John, do you have anything to say about what Guillaume is mentioning here, by any chance?
Yeah, I think that's going to be evolving over the next couple weeks and months. Things have expanded a bit as we ramp up both our contact tracing and community testing. I expect that things will evolve over the next couple months or weeks and months. We, as I mentioned before, really what we're focusing on right now with our community testing is really ensuring that when we identify folks that are high risk for complications from COVID-19, that we're working those angles first. So that's really kind of where our focus is now, but I expect over time things will shift as we engage in more contact tracing. I'm not sure if the state, if you want to talk about the requirements, the testing requirements shifting recently.
I actually don't have any.
It's really hard to hear you. Can you speak up? Sorry.
Yeah, sorry, can you hear me now?
Yeah.
Okay. Jessica, I don't have the most recent information on the testing requirements. That's certainly something that I can follow up with Joy and or Tori on. Unfortunately, I don't have someone from OHA on the line to help back me up, but I can definitely follow up on that point and get that update for you after the meeting.
That would be great. Thank you. So, oh, were you going to say anything else? I don't want to interrupt you.
Oh, I will just say that I know that they continue to ramp up, testing availability for both asymptomatic testing and testing for those that are exhibiting symptoms.
Thank you. And so now, everybody, I want to kind of move into the questions from the chat. So Jacob is going to, I think, hopefully show his face again. He's been kind of compiling these groups of questions to the best of our ability. And I also just want to be mindful here as a reminder that this is a listening session. So all of the answers, we don't have all the answers, but we're fortunate to have a lot of great people from, the mayor's office, representing city council, Multnomah County, the governor's office here to help find answers. So this is a good time to ask questions and we can work towards answers. Anyway, so Jacob, what is one of the big bucket items that people have questions about?
Yeah. So a lot of great questions coming into the chat. We're seeing a lot of concern around unemployment insurance. And what does unemployment insurance look like for employees and contract workers? What if they don't have enough clients or dollars coming in, or the employees don't feel safe coming in? Can people choose to stay on unemployment until they're needed or feel safe?
Does anybody want to field that?
I can take an initial stab at it.
Thanks, Hannah.
Yeah. So for unemployment insurance, if you have an underlying health condition or are considered a vulnerable population over a certain age, or have an underlying health condition that would predispose you to COVID or to make you more vulnerable or susceptible to severe illness as a result of COVID, then you could claim sort of that hardship or vulnerability and not go back to work. My understanding is that the Oregon Employment Department wouldn't follow up in every situation if that were the case, but that they may follow up and ask for proof of a doctor's note if you are seeking an exemption to the rule. But otherwise, if your employer opens and you are not a vulnerable individual, then you need to resume work. Otherwise, you would lose your unemployment. And also, I also want to point out that if you are a business owner and don't feel comfortable opening, even if you are allowed to reopen, once the county enters into phase 1, you certainly are not required by any means to reopen.
Thank you, Rihanna. Jacob, what's the next big
Yeah,
big
so
priority question?
next question, a lot of concern around PPE. You know, can they require clients to wear masks? Is there any resource for getting PPE? Someone had mentioned that there's a shortage of barbicide and they're having trouble getting some of the supplies that they need in order to reopen safely. So 1, can they require their clients to do it? 2, is there a resource to get those materials needed?
Thank you.
Thank you for the question. Business Oregon has a link on their website to a PPE supply connector. It's essentially a vendor list of PPE suppliers. I sent that link, I posted it in the chat, and Brian Guinea, my counterpart at Business Oregon, just posted it again. So that is a good resource for folks. As far as requiring customers or patrons to wear face coverings, there's nothing in the state guidelines that requires that for personal service providers, but service providers can certainly choose to require that of their patrons if they would like. But the guidelines do recommend that if an individual business chooses to require their patrons to wear face coverings, that they establish a clear policy and that they take into account people with certain disabilities that may make it difficult for them to wear a face covering, or for children under the age of 2 years old, and to also take into account that some people may feel disproportionately impacted by having to wear face coverings, especially communities of color that may feel marginalized. But again, the guidelines for personal services or for the face covering guidelines includes information on all of that.
And Rihanna, just to follow up around that, so in some of our listening sessions and webinars that we've had with other types of industries, you know, this has been a sticking point for them, that it's a recommendation to wear a face mask. So, you know, even if they put a sign on their front door that says, you know, no mask, no shirt, no shoes, no service, they're getting a lot of pushback from consumers. And it's really impacting their business because people are going on Yelp and giving them terrible reviews, not saying why they, you know, were asked to leave. So it's having a great impact. So do you anticipate at all, is this an ongoing discussion to change this from a recommendation to something more strident, more strict?
As of right now, there is nothing from the state that would suggest we would make any changes. But I think the governor mentioned in her press conference, I believe it was last week, that individual jurisdictions, cities, for example, could take up this issue if they felt the need or compelled to do so.
Thank you. Jacob, another question, please.
Yeah, so a question came in wondering about what does it look like to have 2 to 3 guests at a time if they're quarantined together? So as an example, you know, a parent with 2 children, where do the kids go when the parent is there? can the mom or the parent stay once the kids are there? Should they come separately? Should people stay outside or in the car? Is there a recommendation for dealing with parents and children?
Sure, thank you. If a client comes in with a child, that is fine, so long as the parent or guardian stays at least 6 feet away from the provider and all other clients at the time. So if the child is getting a haircut, for example, the parent would still need to maintain at least 6 feet of physical distance. And then if you come in with people that you have been quarantined with, I think that that is okay. Yeah, members of the same household, if they come in for a pedicure, for example, can they sit next to one another? The answer is yes. Members of the same household may sit next to one another when getting a service. Personal service providers, however, are still required to maintain social distance of at least 6 feet from one another.
Okay. And so about the child's piece, so is this a recommendation for personal services is to remove magazines, to remove snacks, to remove drinks? And I assume that that goes for like children's play areas and toys and things like that. Yes. Okay.
Yes.
Thank you. Okay, another question, Jacob.
A question came in about sanitizing capes and smocks, aprons and masks. Is there any guidance on that? Is the high heat cycle on a dryer enough to sanitize, or is there is there a specific process that needs to be followed to sanitize those things? They're trying not to use disposables.
We don't know who has the answer.
Let me look at the guidelines real quick, see if I can find something.
Great.
Real quick, 1 moment.
Gam, how are you handling that right now?
Well, it's a very good question, because the guidelines say that massage therapists, they need to change their tubs in between every client. And I don't know exactly how literally they say, but it kind of insinuates that the therapists are touching the clients while they are massaging, right? Which is surprising that that's coming as a guideline, because this is kind of one of the first things that a massage therapists learn at the school, that they only touch the clients with their hands or their forearms. They don't touch the client with any other part of the body, right? So I know that the state board of massage therapists, they asked a question to the state, and I don't know if they have received a clear answer of what they need to do. So for us, in the meantime, what we're doing is our therapists are wearing aprons, vinyl aprons, and basically they have 2 sets of aprons, and in between clients they spray it, they clean it, and so it's a way to I think we are in compliance with what the guidelines of the state say, but it was like initially the guidelines that were recommending us to wear smocks, and that's something that we definitely not. No, we can't do that. We cannot service the therapy, the client with the smocks. So we're going a little bit around about that.
So the guidelines, and I will post them in the chat just in a minute, but there are extensive cleaning and sanitation guidelines included in the personal services industry sector guidelines. I cannot go over them word for word. It would take too much time. So I'm just going to post it in the chat. And as far as drapes and capes, the guidelines say that providers are required to drape each client in a clean cape if applicable for the service. Businesses may consider using disposable capes for one-time use, and that providers should wear a clean smock with each client. Businesses, again, may consider using disposable smocks or gowns for one-time use.
Thank you. And Jamal, so I know you're just getting started with opening, but so what are you thinking about in terms of capes and that sort of thing?
So my barbers, we've invested in, you know, capes that are on the average amount of services that they would do a day. So they can actually use a clean cape for each client and will be washed at the end of the day.
Okay, so these are non-disposable, but you have one client, you use it, you take it off, and then it gets laundered.
Well, I mean, not right away, but you know, they have enough to service the people that they will service throughout the day. You know, the barbers, they know who they service on a regular basis. They know what their average is. And so we've invested in that, and they have capes to put on their clients that'll be fresh and clean for the day.
Great, thank you. And so I guess back to that question, do we know right off the top of our heads with the, you know, if you're using hot water and a dryer, is that considered to be enough to kill COVID-19? Does anybody know?
It's clean.
It's clean.
I mean, if we're talking about, if we want to go into definitions of what clean is, you know, in regards to the state of Oregon, it's free of debris and dirt and any other type of soil, you know, entity, right? And so if it's free of that, then it's clean.
Yeah.
And what do we do to clean? Soap and water, and you know, or some type of other detergent. So, to our understanding and to our training, that's what clean means.
Right. I just wondered if there was any, you know, like, oh, if it's above this degree, Rahana.
Yeah, so in the guidelines, I just want to read one thing that sort of gets to your question, Joy. The guidelines say use disinfectants that are...
Oh, can you speak up, Rahana?
Yes, can you hear me now?
A little bit better.
Okay, the guidelines say use disinfectants that are Environmental Protection Agency registered and labeled as bactericidal, viricidal, and fungicidal. No product will be labeled for COVID-19 yet, but many will have human coronavirus efficacy either on the label or available on their website. The EPA has a list of disinfectant products that meet EPA criteria for use against the virus that causes COVID-19. If in doubt of the product's effectiveness, check the EPA website.
And these are all products that we've had in our shops from the beginning. These are all necessary disinfectants, high-level disinfectants that we use, period. So it's nothing new for us, honestly.
Same here. Same here.
Okay, let's see. I'm trying to get back to the gallery view. Okay, Jacob.
Yeah, so also a lot of questions, people just wondering what the reasoning was to include personal services in the phase 1 reopening. Was there any sort of decision-making process that went into that? And you know, why not delay that group?
Thank you for the question. You know, we've heard from a number of personal service providers who are concerned about being included in phase 1, and those who have adamantly requested that they be included in phase 1. So you have you know, groups on both sides of the issue. I was not in the meetings about any of the decision making as it relates to which industries were included in phase 1 and which were included in subsequent phases. I think the thinking is that with each phase, the level of risk increases in terms of the types of activities or businesses that are allowed to operate. I will also say that I have heard that there is thinking that there are a number of minority and women-owned businesses in the personal provider space, and that people are anxious to return to employment to support their families and households. And the guidelines were developed in consultation with not only the governor's office, but industry practitioners and Oregon Health Authority and public health experts. So again, they tried to thread the needle between allowing for a segment of the economy to reopen in a very in a safe manner. So those are the purpose. That's the purpose of the guidelines.
Thank you.
Can I add something to that real quick?
Please.
I was actually a part of a couple of those meetings, and I was able to hear from the perspective from numerous, people in numerous parts of cosmetology that had different outlooks on should we come back. I don't want to come back. Some was like, I want to get back to work. We need to get back to work. We know what we're doing, so it was different perspectives, right? And so, like she said, the professionals in the health fields were trying to do their best with what they got. You know what I mean? And I was there because I wanted to hear from them. I wanted to hear from the health professionals. Where are we at with this thing? Should we be looking to go back to work, or should we not be looking to go back to work? And so, based on all the information that they gathered, this is what they came up with from their professional health, perspective as to how we could re-enter. So, that's just my take. I was involved in that, and my thing was I was going off the health professionals. I didn't have a perspective whether I'm ready to go back or not. I wanted to know what they thought, and I'm going based off of what their professional, expertise says about it. So that's just my 2 cents on that.
Yeah, thanks, Jamal. I appreciate that. I think that it feels like so many of the things that are reopening, it really is with best intention. I mean, this is just my own personal view from what I'm seeing and hearing, is that it is with to not stifle people from being able to open if at all possible, but with the thought that you don't have to do it. And there's just not like a unanimous vote around whether these things are right or wrong. So again, I think this is why part of the reason that Prosper Portland put together this listening session today with everybody is to try to figure out what has not been thought of yet, and what needs more attention to detail, that sort of thing. So Jacob, what else are you hearing in terms of questions?
Question came in about what do you do if you find out that a client had COVID-19 and they were in your space? What's the response look like? Are you expected to close the business for a quarantine period, or what's the process there?
I can field that if you'd like. This is Jessica from the health department. So we, as I mentioned in the beginning of the session, we provide contact tracing, which we are doing all the time in the background of folks' lives, and hopefully most people don't know about it because we make it a high priority to contact people confidentially and share information in the most appropriate way to find out who's been exposed and get people either tested or treated in a way that is protecting all parties. So we, what happens is any positive COVID-19 test that comes through the healthcare system or community testing, if it's in Multnomah County, and it's the same for other counties, a report comes to us, and generally within 24 hours, we are responding to that positive result and reaching out to that person to do very in-depth interviews, build trust with folks to find out what other interactions they've had over a certain period of time, to then build out interviews and conversations with folks that may have been exposed. What this does not mean is that we will necessarily contact a business owner. It depends on the exposures. and the risk related to the person being in contact with other folks. So there are some situations in which we will contact a business owner to let them know if it's relevant to a risk, and there are other situations where we may not, depending on what the risk is assessed. So the goal of what we're doing is building trust with the person who tests positive to find out real risk of exposure to other people, and then contacting those people for the appropriate treatment or testing. So it depends on the situation, but mostly the tools that we're going to be using are contact tracing and testing, not necessarily closing a business or asking an entire group to quarantine unless they've been assessed as high risk. I do know that the state is taking a slightly different approach with businesses that have more than 30 people employed and 5 or more positive tests. So they have been publicly posting businesses that have that combination of numbers of people and positive tests, which is a little bit different than other situations with communicable diseases. We actually rarely talk about an actual facility because our goal, again, in contact tracing is to get as much information to assess risk, reach out to people individually, both because of protected health information, but also, you know, obviously for impact on businesses to make sure that we're doing that carefully. But the state has taken a slightly different approach in announcing businesses, again, that have more than 30 employees and 5 or more positive tests.
Thank you. So I may be wrong here, Jacob, but I think I saw Stephanie's hand up first. Is that right? Stephanie, do you have a question? I think you're muted.
Unmute. Hello.
There you go. Hi. How are you?
I am an esthetician in Portland in Multnomah County. I closed before the governor gave the okay. And I'm of the opinion, as are most people, that personal services should not be in phase 1. My main concern at the moment is that because it doesn't seem like anybody is addressing our concerns about being 6 feet away from somebody. When I work, I have 1 foot away. Being an esthetician, I can't stand 6 feet apart. I'm literally right there. So that's the main thing I wanted to add. The other thing is that the PUA, if we decide not to work because it's not safe for us, because we only work a foot away from somebody, we will lose our PUA. We can't claim for PUA if we don't go back to work, if we are open in phase 1. Can somebody address the PUA situation? And also, if I make over $200, I won't get anything. I won't get the 200 or the 600. Being a sole proprietor. So the PUA is my main question.
And is there, thank you, Stephanie.
Right,
is there anybody on this call that can even take a crack at trying to address the concerns about unemployment that Stephanie brings up?
Thanks, Joy. It's Rehanna. So again, with unemployment, if one feels that they are a vulnerable population as defined by having an underlying health condition that puts them at higher risk of COVID-19, and or they are, you know, an older demographic, I believe over the age of 60, then they could request that they continue to obtain unemployment benefits as a result. The unemployment department did develop temporary unemployment rules for COVID, recognizing that this situation is unprecedented and requires different sort of policies. So if you are a vulnerable population, then you may continue to receive unemployment. The employment department, it's possible that they would ask for a letter from a medical doctor.
Thanks, Rihanna. So I want to do very quickly a time check here. So we've got 10 more minutes. So I just want to say that if we, ooh, and there was the alarm for that. So if there are questions that we have not gotten to, please continue to put them in the chat and we'll collect all of those and get them to everybody that's from the government offices here in hopes that they are able to go back to their teams and collect some answers. And Jamal, I noticed you were going to say something. I cut you off. I apologize.
So I was just going to say, I know Amy Zimmerman had her hand up, so I want to make sure she got her question.
Oh, thanks, Jamal. Hi, Amy. You're on mute right now.
Hey, thanks everybody. Thanks, Jamal, for pointing that out. I just wanted to get like some very, I just wanted a little more clarity, because it was my question around the whole, like, what is the ethical response we're supposed to have if we know that someone who has COVID has been in contact with us? If a client comes in and we find out that they are in fact positive, what I want to make sure that I'm hearing from you is that we are not required to quarantine post-exposure if we know that someone has come in. I'm not talking about whether or not we're being announced to the public. I'm talking about a personal ethical responsibility to our clients and to the environment that we have where other people are coming in that could potentially be exposed.
Yeah, no, I know it probably sounds counterintuitive, but that is what our contact tracers do, and that's why we respond to a positive test within 24 hours to a person. That's our job. I saw a comment in here that someone said, you know, that are we asking you all to do that? We are not. That's what we do, is to contact people around what level of exposure, doing the interviewing, finding out what kind of risk exposure there is. I mean, you all we can share information with you around how to get in touch with our communicable disease program if you have questions. We have an overflow line where we take questions, and that happened early on in the pandemic where we, you know, were responding to questions from folks around potential exposures or hearing information, because honestly, sometimes information isn't necessarily correct. And so, but we can answer those questions and connect with you if you have concerns. But it's really on the back end. That's our job. That's why we're spending so much time focusing on building out our workforce and making sure we're responsive so that we can connect with people to make sure we're connecting with folks that may have been exposed quickly.
So may I ask a question? Because I'm not sure if you mentioned before that if a client, visit one of our stores and one of our therapists or stylist is exposed for that time, will we receive a call from the tracer, or is going to be the potential spokesperson that will call us? Will be the tracer who will call us?
Yeah, it'll be one of our staff. Yes.
Okay, that's good. And I think that that was a little back to my question. My ask. It will be really, really great that once we get that call, we could be tested. I mean, that's simple like that. I mean,
yeah,
testing. I mean, because it's just going to help everybody. It's going to help the business, especially it's going to help the community, because then we will know earlier if one of our staff is positive, and we can communicate that to anybody who has been with that person in the service, right? So that's hopefully testing capacity will ramp up and we will be able to do that.
Thank you. Jacob, what's another kind of common question that you're seeing out there that we haven't even started to address?
Sorry, I was muted. Yeah, there's a question around using dryers. So how can other states not allow the use of blow dryers and heat sources, no shampooing services, but there's not a mention in the Oregon guidelines about that. Is there any thought about that?
I'll just say that while the governor is in constant communication with her West Coast governor counterparts around best practices and information, they do reserve the right to have differences in how they reopen or in their guidelines to respond to their state's unique situational needs. So not all of the guidelines across all of the states are exactly the same.
And so this isn't something that I even know anything about. So Rihanna, can you talk about that at all, about what other states are doing around blow dryers and this kind of thing? Maybe I'm the only one that doesn't know this piece.
I haven't heard of it either.
I don't have an answer to that. Yeah.
Okay. Just out of curiosity. Jacob, so what's another question, please? Oh, you're on mute.
Sorry about that. A question about being exposed. So if it turns out that you were exposed to someone and you have to quarantine afterwards, will you qualify for unemployment assistance at that point?
If you have COVID, yes. And I will, I did send, I posted some things in the chat around PUA and the Oregon Employment Department's sort of process or rationale for people that are of vulnerable populations, but I'll see if I can find the temporary rules for that were developed for COVID-19 in particular as it relates to unemployment.
Thank you. And Bryce, you are our last question of the day. Welcome.
Hey, I hear kind of looping around the question that I've asked. I am asking if we're required to step away from work for 2 weeks to quarantine, if we're being told by tracers that we've been exposed, where is the PUA then? The answer that we just got from Rihanna is, I get it, if we become if we become COVID positive, right? But you're asking us to step away from our income that we've just been away from for 12 weeks, right? And not providing us any source of reassurance that we may qualify for 2 additional weeks of PUA. You're sending us back into the trenches to deal with people who are requesting these beauty services, right? And if we're gonna be violating social distancing practices because you've put us in phase 1, what protections do we have as service providers on the financial end of things to know that if we're asked to step away from our job for an additional two weeks on top of the last 10 to 12 weeks that we've just spent going crazy at home, right? Where is the support for us being put in phase 1 and being asked if we do come into contact, which will happen at some point, where's the support for us financially if we have to step away from work for an additional 2 weeks?
Thank you, Bryce, for the question. I don't know that anybody has an answer to that. Any more than Rihanna kind of touched on already. Does anyone want to feel that again or talk in more depth about it to Bryce's point?
The only thing I say is that we will not need to be in quarantine if we are able to be tested. And if we are tested and we are positive, then obviously unemployment will cover us. If we are in quarantine without knowing if we are positive or not, just because we've been exposed, then we might have issues to get unemployment. But that's why I was insisting on, hey, we need to be able to test as soon as we are exposed, because then we will have a much clearer picture of where we are, right? Whether we are positive or not. We are not positive, we can keep working. We are negative, we can keep working. If we are positive, we need to stay home, but we can get unemployment. That's kind of my...
So I had a conversation, I don't know if I'm unmuted here. I had a conversation with a healthcare provider, my primary healthcare provider this morning, and he said that the CCRI testing doesn't pop a positive COVID result for 3 to 4 days until after you've been exposed. So yes, we'll get the call, hey, you've been exposed, go and get tested. But that call, if you're saying that that call could come within 24 hours of the exposure, we may not know for another 3 to 4 days, and then 36 hours after for the testing results, whether or not we are positive, right? So it seems like the only sure way of receiving a phone call that says, hey, you've potentially been exposed to someone with COVID is to self-quarantine for 2 full weeks. I recognize that, yes, if testing were available, but it's not. You still have to have a doctor's order to go and get a COVID test. So the access to that testing isn't there. And I realize that you're saying that that is a potential shortening of the situation that I'm talking about, but the access to testing isn't there, and the window of time that it takes to show a positive corona test or a positive COVID test result is 3 to 4 days. And that literally a conversation I had with a doctor this morning. So there is no way of saying, yes, if we had access to testing, that would be awesome. But that's still a week at minimum of potential uncertainty where we may not have the ability.
All right, everybody. Thank you, Bryce, for that. So it sounds like there are a lot of unanswered questions. There's a lot of concern here. Our time has ended, so it's going to zoom us out. It's going to shut down on us in a minute. So I apologize that we do have to cut it early, even though there's so much more to discuss. So thank you to Prosper Portland for putting this together. I would recommend reaching out to Prosper if you think that this is something that you want to have a continued conversation about. If your sector really wasn't touched on, they are putting together lots of these listening sessions for industry specific folks. So I would recommend that. And the recording is going to be available so you can refer back to it. And I'm sorry, there's so much on the table that we didn't get to cover today, but I want to thank everybody for being here, and please be well and take good care of yourselves. Thanks for everybody. Tori, any last word? Actually, any?
Thank you. You're fine. Thank you.
Okay, great. And Guillaume, thank you so much. Jamal, thank you. Appreciate you.
Thank you for the invitation.
Thank you. Bye-bye.